This is a word for the baby boomers. So what are the baby boomers? I mean, these are people who were born between 1960 and 1970. So people are in their 50s and 60s nowadays. Why am I talking about it? I'm a baby boomer, of course. But I mean, this is the generation which has in their hand now to determine, at least in part, how long and how good they're going to live. Meaning, what's their lifespan, but more importantly, what's our health span? So, with modern biotechnology and medicine, we can prolong the lifespan, but that's not really the goal. We don't want to just numerically make us older and live longer in number of years. What we want is we want to increase the health span, meaning we want to avoid what I'm seeing every day in the hospitals, people sometimes in their 50s, 60s, early 70s, frail, immobile, extremely weak, multi-organ failures. I mean, there's horrible conditions, of course, what we have to deal with. But I mean, there are certain things the baby boomers, can do to try to avoid that. And it's not just medication, and it's not only the diet, but it belongs to a whole spectrum. Even in your 50s and 60s nowadays, you can change. You can basically change your life if needed. And changing doesn't mean to become a different person, no. But a lifestyle modification is absolutely necessary if you want to achieve longevity and a longer health span. And that includes exercise. And I have to say it over and over and over again. Because if I ask patients every day, the baby boomers in particular, do you exercise? Oh, yeah, sometimes, here and there. No, that's not enough, guys. I mean, 5 times a week, 30 minutes minimum per day of moderate intensity exercise. Diet, stay away from the salt, stay away from the sugar, in easy terms, basically. A healthy Mediterranean type balanced diet is the most heart healthy and vascular healthy diet which is out there. And there's a large variety of different types of diets. There's like 21 countries surrounding the Mediterranean Sea. So it's not one particular food group, it's a variety, but it means basically less red meat, more vegetables, more salads, food, fresh food in particular, little red wine, definitely not a bad thing to have. And then if you have certain deficiencies, have them checked out. I mean, how many people do I see who tell me they haven't seen a doctor in 5 years, 10 years? They felt good. Well, don't need to see a doctor. Well, that's wrong. You should see your doctor once a year. In your middle ages, you should have your cholesterol checked, your sugar levels checked, your kidney levels checked, and certain vitamin levels, for example, vitamin D levels, and so on, to counteract if there's any deficiency. And then if there's issues like high cholesterol or high blood pressure, well, it doesn't hurt. I don't need to treat it. No, wrong. It doesn't hurt, but it's the silent killers which kill us at the end. Even though there's no symptoms of high cholesterol or high blood pressure, we need to treat them. Be proactive. It's in your hand nowadays to really determine if you live another 10 years or another 30 years. You know, this is what we can do nowadays. And don't forget one thing, and that's often forgotten by very active business type people, whether it's in the medical field or anywhere in any other field, is take the time to have some rest, to recharge your batteries. If you don't have the rest, if you don't have a healthy sleep hygiene, you wear yourself out, and that causes years of your life. More to come.